Good evening, everybody, and welcome to another edition of our question lab. Okay, so tonight we're going to be tackling a set of questions based in musculoskeletal. So to do this, I am joined by our regular Q lab specialist, Dr. Paris Vicaria. Paris, would you like to introduce yourself to the crowd?
Thank you, Jeff. Hey guys, my name is Paris. I'm a dermatology resident in Dallas, Texas. I originally graduated from pharmacy school and then went back home to do medical school in Michigan. I am also an RX coach with USMLE-Rx, so I work one-on-one with students such as yourselves to help prepare you guys for step 1 and step 2 CK as well. And I'm happy to help lead tonight's session.
You've met Paris and Brian. They are both RX coaches. We're going to talk a little bit more about RX coach as the night goes on, but I want you to know that the process that we use during our question labs is very similar to the process that we use when coaching students like yourself. So our methods are comparable to what our tutoring students get each time they meet with a coach. And the main thing here is that we want you to develop a methodology, and you'll see that as we go through it, we're going to kind of step you through our process, as well as the way that you should be approaching questions. You don't have to follow our process, but we know it's important for you to have one so that you can be more successful on exam day. So with that in mind, we are going to start off with question number 1. When we open it up, if you're new, you're going to see a couple of things that are different. First thing is we don't show you those answer choices right away, and it's because our advice is to cover up those answer choices so that you don't get distracted. You don't see a term or a disorder or something that you're unfamiliar with that might cause anxiety or might trigger feelings of maybe I don't know this. Okay, so we say cover it up, and then we ask you to read the lead in, right? So we ask you to read that question and then read the stem. So what we'll do is we're going to start off with a lead in. Which of the following cell types is most involved in the pathogenesis of the patient's disease? So that's the question. Think about what kind of information you might be looking for from the stem as we read it. A 50-year-old woman comes to the clinic with knee pain for 2 months. Her pain is worse at the end of the day and is relieved with rest and ibuprofen. She works as a clerk and is mostly sedentary. The patient is 170 centimeters tall and 93 kilograms for a body mass index of 32.1. An X-ray of the knee is shown below. So again, which of the following cell types is most involved in the pathogenesis of the patient's disease? Think about that, what you're being asked, and let us know in the question box, how many steps do you think it will take to solve this? Is this a 1-step, 2-step, 3-step question? Go to the question box, let us know what you're thinking, as I turn it over to Paris to help us break this one down. Paris?
Thank you, Jeff. So what we're going to do is we're going to take a look at that vignette and the lead-in and kind of show you what we think are the important clues in that. Okay. Now, usually when you have a question like this, especially a clinical question, the first thing they're going to give you are demographics. So in this case, it's a 50-year-old woman. So you definitely want to make note of that because that can clue you in a lot of times into what's going on, especially when we're talking about, MSK, musculoskeletal injuries and things like that. Okay. Then they usually tell you, why are they coming to the doctor? Why are they coming to the emergency room? In this case, it's because of knee pain. And so it's important to make note of what brought them in to see the doctor. And then also, sometimes they'll tell you how long it's been going on for. So in this case, they say 2 months. So that gives us a little bit of chronicity. It can be shorter, it could have been 2 days, it could have been 2 years. So that's also helpful when coming up with what could be causing this issue. Okay. Now in this case, whenever they talk about knee pain, there are some important things you always want to find out about. When is the pain worse? What makes the pain better? What are their jobs? What are their hobbies? What is their BMI? Is it symmetric? Is it not symmetric? Which joints are affected as well? If in this case they don't tell it to us as well, some other things, but description of the joint, is it red, tender? Is it swollen? Is there a fluid collection? All things you would want to be looking out for when we talk about knee pain. Okay. And in this question, they're specifically asking us about the pathogenesis of this patient's disease, but specifically, even further in that, the cell type involved in the disease pathogenesis. So I think we've got a couple steps here. I think 1, we've got to figure out what is this patient's disease. 2, what is the pathogenesis of this disease? And 3, which cell type is most involved in that pathogenesis? So I think we've actually got a 3-step question here. So let's go ahead and let's take a look at those answer choices. And what we're going to do is first we're going to take a look at actually a blow-up of that x-ray. So you can get a nice good look at that. And then we'll take a look at our answer choices. And what you see here are we have 5 answer choices. And when we work with students, we actually recommend that when they review the answer choices, they start at the bottom and work their way up to the top. So start with answer choice E, and work your way up to A. And the reason we do that is because a lot of times we'll see students who start at the top and they'll see something they like, and they'll select it without having gone through all the choices. So sometimes they'll get that question wrong. So we recommend doing it this way to prevent yourself from biasing yourself. So let's go ahead and do that now. Answer choice E, T cells. D, neutrophils. C, macrophages. B, eosinophils. And A, B cells. So we're going to go ahead and open up that poll. Go ahead and select what you think is the best answer here, and we'll talk about it in just a few seconds.
Okay, thank you, Para. So we have launched the poll, and it looks like there may be a slight error in the poll here. So you may want to go to your the question box and let us know if you've got a separate answer. Apologies for the technical issue here. I'm gonna let folks. I see some answers coming in through the question box. I see that Jason had already provided an answer even before the answer choices were up. So nice. So what I'm going to do is we're going to go ahead and we're going to close this poll a little early, and then we're going to we'll share the results. A little over half of you thought neutrophils, about a third of you thought T cells. And I see a number of folks that were thinking that it might have been macrophages. So we're going to go ahead and hide those results. And the answer is answer choice C, macrophages. So with that, and apologies again for the technical glitch, I'm going to turn it over to Paris to help explain this one.
Thank you, Jeff. Yes, absolutely. Great job for those of you guys who selected this answer choice. So let's take a look at what's going on here. So, we've got this patient who's a 50-year-old female who is obese with the BMI of 32, mostly sedentary, and pain that is worse at the end of the day. So suggestive more of osteoarthritis, okay? You can also see here those red arrows pointing to narrowing of the joint space, okay? The joints, there should be more joint space in between those bones, okay? You can also see kind of at the periphery those little white specks that kind of look like little shards of glass, and those are Osteophytes, those shouldn't be there, okay? Those indicate disease as well, okay? So if we take a look at the next slide, we can see here talking about osteoarthritis, okay? And this is pulling the table from first aid. And you can see here that the pathogenesis of this is essentially a wear and tear disease, okay? And you get inflammation. We'll talk about what kind of inflammation, but basically you get degradation without good repair. Now, our patient meets some of those risk factors with her age. She's female, she's obese, okay? And this is pain in a weight-bearing joint, especially the knee, okay? And it is improved with rest, like our patient, and it is worse at the end of the day, like our patient, okay? If we take a look at the next slide, on the second slide, you can also see that some of those joint findings. You can see some of those osteophytes. You can see joint space narrowing. These are things that also suggest osteoarthritis, okay? If we take a look even at the next slide, a third slide, this is again showing, this is a nice diagram from first aid that shows both in a diagram but also on x-ray, some of those things that you would see in osteoarthritis, those osteophytes, the decreased joint space, okay? Even the sclerosis or the white thickened line there, that's called sclerosis, and that can also be seen in osteoarthritis. So you can see these are very different than the normal joint findings that you would see on the right. Okay, so if we go back to our question and our vignette, we've now decided that this is osteoarthritis, and this is due to inflammation. And this is due to actually activation of macrophages, okay? And this leads to destruction of the articular cartilage, like we talked about, some of those other degenerative changes. So this is actually a disease where macrophages are most involved. Okay. Some of the other answer choices, both T cells and B cells, that would be if we were talking about rheumatoid arthritis or a more inflammatory disorder like arthritis and lupus. Neutrophils, that would be seen in an infection like septic arthritis, where you have a fever. Eosinophils, that's more less of a great answer here. That's more in like parasitic infections, allergic reactions, so not as great of an answer here. So the best answer here is answer choice C.
Excellent. Thank you, Paris. And again, well done to those of you that knew it was C and pushed forward with that. Everyone else, hope you picked up the key reasons why that was the correct answer. So let's go to question number 2. And again, we've got all of those answer choices covered up, and we're going to start off with the lead-in. Which of the following is most likely responsible for this patient's flushing? Think about what kind of information you might be looking for, what kind of data will be helpful to answer this one as we read the vignette. An 18-year-old male soccer player is brought to the emergency department after collapsing on the field. He is awake and reports feeling lightheaded. Temperature is 38.4. On physical examination, he is diaphoretic and his skin is flushed, even across the palms and soles. So again, which of the following is most likely responsible for this patient's flushing? And you can go ahead and head back down to the question box. Let us know how many steps you think this one was. Again, that first question seemed like about a 3-step. How many steps do you think you're going to need in order to get to the correct answer? And with that, I'll turn it over to Paris.
Thank you, Jeff. So once again, we are going to go ahead and show you what we think are the important clues in this vignette and the lead-in. Okay. So now we have a younger patient here. This is an 18-year-old male. But interestingly, you notice they tell us right off the bat that he's a soccer player. Okay, that's not by mistake. Whenever they give you some social or demographic clues right off the bat, it's usually relevant to the question. So you want to make note of that. Okay. And in this case, we're told it's because he collapsed on the field. That's why he came to be seen. Okay. They give us a little bit of important information about how he's doing, his vital signs, but also his physical exam findings, okay? He's diaphoretic, his skin is flushed, even on the hands and soles, okay? And as you guys remember, when we first read that question, they asked about flushing, so that should have piqued our interest, and we should have made note of that in the vignette. Now, this question is asking about what is responsible for the flushing. So I think we've got maybe a 1 or 2 step question. It kind of depends on the answer choices. I think maybe 1, we've got to figure out why is the patient flushing, and then 2, what is responsible for the actual flushing component, maybe. So maybe a 1 or 2 step question depending on what the answer choices are. So let's go ahead and let's take a look at those answer choices. Once again, we're going to start at the bottom and we're going to work our way up to the top. So you can see here there might actually be another step. This is kind of going a little bit in depth into like kind of the mechanism. Okay, so we'll keep that in mind. So answer choice E, inhibited skin endothelins. D, increased vasoactive intestinal polypeptides. C, increased sympathetic activity. B, increased skin bradykinins. And A, decreased sympathetic activity. So we're going to go ahead and open up that poll. Go ahead and select what you think is the right answer here, and we'll talk about it in just a few seconds.
Okay, excellent. Thank you, Paris. And this time we've got all of the answer choices loaded up. So take a look and make your selection. We do want to remind you that when you are taking your exams, it's important to answer every question. You're not going to be penalized for wrong answers. So make sure you don't leave any answers or any questions unanswered on test day. Let's see, we've got a little over half of you have voted so far, and looks like seen a couple of favorites. Give just a few more seconds, and then we are going to close the poll. Okay, let's shut her down, and let's take a look at these results. So it looks like increased sympathetic activity is the one that has gotten the most votes up to this point, with increased skin bradykinins coming in second. So let's see, let's close or hide the results and take a look at the answer. And the answer is answer choice A, decreased sympathetic activity. So it was a distant third, according to the audience, but this was the right answer. So with that, I'm going to turn it over to Paris and let him tell us what happened.
Thank you, Jeff. Yes, definitely a tough answer and tough question here. So let's take a look at what is going on. So this patient most likely has heat exhaustion, okay? He's sweating, he's got a high temperature, and it's one of the heat-related syndromes, okay? And so one of the causes is being having prolonged exposure to heat or strenuous exercise, probably like this patient was, okay? Now, how this manifests as flushing is that our skin becomes flushed when there is decreased sympathetic activity, okay? Because remember, sympathetic activity generally causes vasoconstriction, okay? So sympathetic activity, if it were increased, it would cause constriction of those blood vessels in the skin. That would actually manifest not as flushing, the opposite. While if you have a loss of sympathetic activity, you lose that vasoconstriction. So now you've got a little bit more vasodilation of the capillaries in the skin, and that leads to flushing, okay? Relaxation of the vascular tone, okay? So in this case, decreased sympathetic activity is the one that would lead to flushing. Increased sympathetic activity, like we said, would not lead to flushing. It would be the opposite, okay? Increased skin endothelins. That is not like a normal physiologic thing. That's kind of just a red herring of an answer choice. Increased VIP, answer choice D. That has more to do with vasodilation in the GI tract, more so, and also the lungs, not as much the skin. And then increased skin bradykinins. That's usually can cause flushing or swelling in the setting of inflammation. Kind of if you were to take certain medications or be prone to certain conditions, not so much in the setting of heat exhaustion. So the best answer choice here is answer choice A.
Okay, so this was a tough one. Clearly tripped up quite a few folks here, but hey, it's okay, right? This is the time to get this one wrong. You want to make sure that you're taking this information and taking it all in so that you're ready to answer this right on test day. So let's see. Again, we talked a little bit about RX Coach earlier. We are working and have been working with hundreds of students here since RX Coach first launched, and we feel like our approach and our experience um, can help you get to where you need to go. And when folks ask, well, what's the RX Coach difference? Part of it is that we start with a 160 question assessment. We have you go through that, and that will give us the opportunity to figure out where you're at. What are your strengths? What are your weaknesses? Where are the areas where you may need additional emphasis? And we use that and work with you to build out a personalized study plan. Are there areas that where you need remediation? Are there areas where you need specific guidance? So again, with us, it's a one-on-one approach. You're working with one of our highly trained RX certified tutors like Paras or Brian, and each session, really working to help you get to your goal. On top of that, you get access to our RX 360 Plus program, which includes RX Bricks. So you've got all the questions in Step 1 QMAX, the 1,300 videos, the 15,000 flashcards, the 800 plus bricks. So you've got a great bank of resources to build from. So again, if you're ready, if you feel like your your results don't seem to be matching the efforts that you're putting in to your studies, let us know, and you can go to www.rx-coach.com. Put that in the chat for you, and you can go and set up a free consult and learn more about the program. And if you find that that this sounds like the right approach for you, we'll put a plan together and get you on track. Okay, we're going to head into the second half of tonight's event, and that means question number 3. We are going to have a raffle at the end of the event. You do need to be present in order to win. So again, we're going to start. We've got all of those answer choices covered up, and we're going to start with the lead-in. Which of the following is the primary mechanism of this patient's most likely disease? Think about the wording of that particular question and what is it that you're going to need to determine in order to get to the answer. And with that, we're going to read the vignette. An 8-year-old boy is brought to the pediatrician because of pain and swelling in various joints over the past 48 hours. The symptoms began in his left knee, then moved to his left hip, and most recently to his right shoulder. He had a fever and sore throat 3 weeks ago, but has otherwise been healthy. The family migrated 2 months ago from a large urban center in Central Asia, where they lived in poverty with limited medical care. Temperature is 38.1. Physical examination discloses a holosystolic murmur at the cardiac apex, several subcutaneous nodules at the elbows, and the rash seen in the image. Urinalysis is normal. So again, which of the following is the primary mechanism of this patient's most likely disease? Go to the question box. Let us know how many steps you think it'll take to answer this one as I pass it over to Paris.
Thank you, Jeff. So once again, we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in, okay? And so now we've got a younger case, a younger patient. This is a pediatric case, okay? And also, as we know, this is an MSK case. So this patient is coming in because of pain and swelling in various joints, okay? They do give us a little bit of information about chronicity. That's going to be important in this case. It's been going on only for the past 2 days. You know, like we talked about earlier, when you have knee pain, you want to ask about what joints are affected. And here we're told about a little bit of where it started, where it moved to, some other things that happened a couple weeks ago. And then, you know, whenever they tell you about a family or a patient, you know, migrating from somewhere, you know, where do they live? How did they live? Do they have access to medical care or not? These are things that you want to think about and ask, you know, why are they telling this to me? What kind of things can I be getting out of that, those clues that can help me answer this question? There are certain things, you know, I won't go into it just yet, but there are certain things that you definitely want to think about in that situation, okay? We're told about vital signs, physical exam findings, and importantly, and as a dermatologist loves, there's a rash, several subcutaneous nodules at the elbows. I don't know if the rash picture is being seen here, but our apologies. I guess that picture may not have come through.
I don't see it.
But I think this question should be something that you still should be able to answer, just given this vignette. But we'll do the best we can on this question. So this question is asking about the mechanism of the patient's most likely disease. Okay, and so again, I think we've got a couple steps here. I think one, we've got to figure out what is the most likely disease, and two, what is the primary mechanism of that disease. So once again, we're going to start at the bottom, and we will work our way up to the top in this two-step question. Answer choice E, Streptococcus pyogenes bacteremia. D, release of preformed exotoxins by Staphylococcus aureus. C, immune complex deposition. B, exotoxin-mediated injury. And A, antibody cross-reactivity against foreign and host antigens. So we're going to go ahead and open up that poll. Go ahead and select what you think is the best answer here, and we'll talk about it in just a few seconds.
Thank you, Paris. We're going to open up this poll. It's launched right now. So again, go in there and choose which of the following that you think is the primary mechanism of this young boy's most likely disease. Quite a few modifiers within this particular, within the wording of this question. So a lot to parse. Okay, let's see. A little over half of you have already voted, so that's great. Let's get everybody in here. Get your votes recorded. Okay, looks like almost 3/4 of you have voted, so just a couple more seconds and we're going to close it. Okay, so poll is closed. Let's share those results. And again, looks like we've got pretty strong favorite there with answer choice A garnering almost half of the vote, whereas answer choice E pulled in just a little over a fifth of the vote. So roughly a two-horse race here, but that proved to be misleading last time. So let's go ahead and hide the results and figure out the answer. And the answer is answer choice A, antibody cross-reactivity against foreign and host antigens. Great job, everybody. Almost half of you got that one right. Nice work. If you didn't get it right, that's okay. Pars is here to help break it down for you. Pars?
Thank you, Jeff. Yes, great job, guys. This is a nice, really good case of rheumatic fever. Okay, so this patient's got a holosystolic murmur. Okay, skin nodules. If we take a look actually at the next slide, I'm looking at the table in first aid. This actually goes into those criteria of rheumatic fever. You can see that our patient had this. Okay, our patient had migratory polyarthritis. And it was not just arthritis, but it's migratory. So it can kind of move. At one time, you'll have pain in this joint, and then it'll move to another joint. And that's called migratory polyarthritis. It's moving and it's affecting multiple joints. Okay. You can also have carditis. We know that this patient did have cardiac involvement, did have a holosystolic murmur. We were also told about subcutaneous skin nodules. Okay. We were also told about a rash. We apologize again for not having the image, but it did kind of show a red rash with kind of a ring around it, but another one of those criteria. We weren't told about any type of choreiform movements, like involuntary movements, but that would be another thing you'd want to ask yourself in terms of major criteria for rheumatic fever. Okay. And why this patient developed rheumatic fever is they most likely had a strep infection growing up. And they told us that this patient grew up in an area without medical care and they were in poverty. So they probably did not receive treatment. Okay. So they probably did not receive treatment and access to antibiotics. So as a result, they were at risk of developing rheumatic fever. Okay. Now, the reason you develop this disease is there is cross-reactivity between antibodies against foreign and host antigens. You can see there in the third paragraph of that middle column, it's an immune-mediated reaction. Antibodies to the M protein cross-react with self-antigens. Okay, that's called molecular mimicry. Okay, so antibody cross-reactivity that were initially directed against foreign antigens also now react against self-antigens. Okay, so if we go back to our question and look at our answer choices, hopefully you guys will see why this is the best answer, but also why this patient had a rheumatic fever to begin with. Okay, we'll go through those other answer choices. Streptococcus pyogenes bacteremia. This could be associated with a few things like fever, but I would expect a patient to have more of a septic or shock-like symptoms like low blood pressure, tachycardia, altered mental status. And again, we know that there's something a little bit more chronic going on here. Answer choice D. This can be cause certain types of toxic shock syndrome or staph scalded skin syndrome. But again, we would expect more of heart rate, blood pressure abnormalities, not so much that wouldn't explain the nodules or the murmurs or the joint pains. Immune complex deposition, that can cause a couple things, like post-streptococcal glomerulonephritis. So if a patient were to have strep infection and then develop kidney injury, that would be the better answer choice there. But obviously, this is a different type of post-strep complication. And then lastly, exotoxin-mediated injury. This would be also potentially caused by a bacteria like Streptococcus pyogenes, but you would get more of different presentations, so not the best answer choice there. So hopefully you guys picked up on why that was the best answer choice here. So great job on this question.
Yeah, definitely nice work, everybody. That was appreciate the in-depth explanation there on what is happening there with rheumatic fever. Okay, we've got a little bit of momentum going into the final question of the night, question number 4. So everybody, let's all lock in here and see if we can close strong. And one more time, we've got all of those answer choices covered up, and we're going to read that lead in. Which of the following is the most likely diagnosis? Okay, that's a pretty straightforward question. You can let us know how many steps you think that's going to be, but let's go ahead and read the vignette. A 65-year-old man comes to the physician with worsening weakness over the past several months. He says he has difficulty climbing stairs and opening jars. He eats a normal diet. When asked to stand, he uses his hands to lift off the chair. Serum studies show potassium of 5, thyroid stimulating hormone of 4, and creatine kinase of 500. Erythrocyte sedimentation rate is 15 millimeters per hour, and C-reactive protein is 32. Biopsy of the quadriceps muscle shows rimmed vacuoles, endomysial inflammation, and myofiber degeneration with amyloid deposition. Okay, so again, which of the following is the most likely diagnosis? Let us know how many steps you think this one is, and we're going to pass it over to Paris. Paris?
Thank you, Jeff. So once again, we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in. Okay, and so this is our 4th time doing this. So hopefully, you guys are getting a sense of, what are those important clues that you need to be picking up on, but also the important questions you want to be asking in these MSK type questions. Okay, so now we actually have an elderly patient, a 65-year-old male, and he's coming in with just generalized weakness, it sounds like. Okay, but it's been going on for several months. Okay, so we get the sense that this is kind of a chronic issue. They tell us some important things. He can't climb stairs, or difficulty climbing stairs, opening jars, has a hard time standing from a seated position. We're given some lab values there that you would definitely want to interpret. Okay, and then we're given information about a biopsy. Okay, and they give us very important concrete information about what that biopsy showed. Okay, so obviously they're kind of getting at a specific diagnosis here, and that's why, as Jeff said, this is kind of a one-step question, most likely diagnosis. We're given a lot of clues here and specific biopsy findings that would potentially hone in on one diagnosis. Okay, so let's take a look at the answer choices. Let's see what we're working with here. Answer choice E, polymyositis. D, necrotizing myopathy. C, inclusion body myositis. B, hypothyroid myopathy. And A, drug-induced myopathy. So once again, we're going to go ahead and open up the the poll. Let you guys select what you think is the best answer. Talk about it in just a few seconds.
Okay, thank you, Paris. So the poll is open. What do you think is the most likely diagnosis? Go ahead and make your selection. Looks like about a quarter of you have voted so far. Strong support for one of these answers. Let's get more of your reactions in here. Again, we're going to have we'll have that raffle here right after this question. You do need to be here in order to win. One lucky winner will get a subscription to RX 360 Plus. Okay, almost 3/4 of you voted. Give you a couple more seconds. Okay, I'm going to close the poll. And let's share those results. So as noted, over half of you thought it's answered choice E. And a little over a quarter of you were thinking answer choice C, inclusion body myositis. So let's hide those results and reveal the real answer. What is the correct answer? And it is indeed answer choice C. So another tricky one here. So what tripped us up here, Paris?
Yes, thanks, Jeff. Yes, this is definitely a tough question and a tough topic as well. You could tell just by those answer choices that we're working with some conditions that maybe we're not all as commonly familiar with. So let's take a look at what's going on here. So this patient, as we're told, has a weakness, okay? And the weakness is essentially in the proximal muscles, okay? We're told difficulty climbing stairs, so using those hips, standing from a seated position, so also, those proximal muscles of those hips. So we know this is definitely a muscle issue. And we can also see that creatinine kinase of 500 is kind of high, okay? So definitely know that there's something going on with the muscle, and we knew that as well when we saw the biopsy findings, okay? Now, the reason this is inclusion body myositis is it's a little bit something kind of more so, if you weren't too familiar with the biopsy findings, it may have been a little bit harder to come to this just by itself. It may have been possible to exclude some of the other answer choices, which we'll talk about. But if we take a look at the next slide, this is what you see on inclusion body myositis, okay? So on the left is what we call healthy muscle, okay? You see your normal muscle, your fascicles, and that separate your bundles. You have normal muscle fibers. But in inclusion body myositis, you've got a couple things. You have these inclusions, hence the name inclusion body myositis. You've got these inclusions. You've got degeneration of muscles. You can see that the muscle fibers are not as healthy. They're a little bit smaller, and the fascicles between the muscle fibers and bundles are bigger. That's because the muscle has degenerated a little bit. And you can also see those vacuoles, and you can see that those vacuoles kind of have stuff in it, okay? They're kind of rimmed by certain things, okay? And so that is kind of a specific diagnosis or specific findings for inclusion body myositis. So if we go back to our question, take a look at those, the biopsy findings and the other clues, that'll hopefully make sense. Now, you may have been able to also come to that correct answer by excluding some of the other things. Okay, so polymyositis usually it is also an inflammatory myopathy, but you would see a couple other things on biopsy. You would see inflammation of the endomysium or endomysial inflammation, which we're also told here, but you wouldn't necessarily see any of the rimmed vacuoles, inclusion, amyloid deposition. Necrotizing myopathy, that would show more just necrosis of muscles, okay? Hypothyroid myopathy, this patient has a normal TSH, so that's not likely. And drug-induced myopathy, we're not told about any drugs that could do that, like steroids or statins, so probably not as good of an answer choice there. So definitely a tough question here, but this is something that you may want to keep in mind because these myopathies and myositis are definitely fair game as well. But overall, great job tonight on today's MSK session. Definitely a tough topic, but I will pass it back to you, Jeff.
Excellent. Thank you, Pars. Thanks, everybody. You guys, again, good work. Had great responses on every question tonight, so you guys were clearly locked in, and that's what's key. We're here to learn and kind of see where we're at, right? So here were the question IDs that we used for tonight's session. So if you want to screenshot this or write them down, you can open up USMLE-Rx if you've got a subscription and type them in and learn a little bit more. You can see not only those full explanations, but also checking out the pages from First Aid that provide additional explanation as well as relevant bricks.